Hello, it's my pleasure to meet Dr. Clive Thomas today, who is a mental health nurse with extensive experience of working with people who have dementia, particularly around their diagnosis, and huge experience in setting up memory clinic services. So, morning, Clive.
Hi, Jane.
We hear the word cognition a lot when we are working with people who have dementia. So, what is cognition exactly?
Okay, so if you like, cognition is an umbrella term for all of the thinking processes that perhaps we take for granted every day, and all the things which we do to help us get through everyday tasks, things like judging, making decisions. And one of those is, for example, our ability to attend. So attention to tasks, being able to concentrate, holding that concentration and maybe not being distracted. Because very often we pick up on the fact that sometimes people don't stick to doing one task and get easily distracted and maybe start doing something else before finishing one particular task. Um, Again, another part of cognition is memory, and maybe traditionally we've thought of dementia as only affecting memory. Memory is a very, very big part of um, the symptoms, if you like, that people can show when they have dementia, but it's by no means the only thing that affects them.
Mm.
So we would expect perhaps somebody not to be able to remember certain things like dates and times, being orientated to person and place, but that isn't very necessarily the thing which will happen always, and there can be other subtle changes which perhaps people are not aware of, and that's why it's important to consider all of these different facets when somebody comes forward for an assessment. I said then about changes to memory, but also we have to consider how people perceive their world,
Mm.
because again, it might be very, very different for them, and it might be quite alarming. It might be that they're seeing and experiencing things differently to the way that they have done, and certainly differently to the way that we perceive the world. So it's really trying to understand what it is that they are experiencing. Um,
So when,
Another report, sorry, go on.
no, I was just going to say, so when a person's experiencing difficulties like with their attention, we hear a lot about attention deficit now, don't we? We're understanding that more, and then if they're not able to be seeing or hearing and taking in all that information, and then they're struggling with their memory, that can be really frightening, can't it? So it makes sense why a person might be quite distressed, mightn't it, when they start to have cognitive changes.
Absolutely. And again, you said at the beginning there about setting up memory services, and one of the things which I've been quite sort of involved with is trying to get people to come forward for that assessment when they are experiencing these changes. And the thing is, it might not necessarily be the case that something is going on that needs further in-depth assessment, but certainly seeking help is a good thing to do, because that means then that you can get the help that you need. You can sometimes be signposted to other things which can help. For example, if somebody's low in mood, then if that's addressed for whatever reason that they're feeling low, then that may mean that they become more stimulated, and they're not then experiencing what they might consider to be changes to memory or the other cognitive processes.
So other things can affect cognition, can't they? We know that low mood can, perhaps thyroid. So people, hypothyroidism. There are other sort of
Yeah.
conditions that we need to screen out, aren't there, when we're actually
Absolutely. And
assessing.
and that's why, again, it's so important that people do get that initial assessment. And the best place to go for that would be to go and see your GP. because we have to really rule out all of those physical and reversible causes before really then jumping to any kind of conclusions. But equally,
Sorry, go on, Clive.
no, I was going to say, but equally, we just need to make sure that people get to the right place at the right time. And what we do know is that unfortunately many people neglect those symptoms or try to forget that bury it really, and therefore miss out on some of the options then to be able to reverse some of those symptoms very early on. And
Yeah.
we talk now also about really making the best and living well with the condition, because there's plenty of evidence to say that if you do things which are better for your well-being, they can also help with the symptoms.
Absolutely. And so by understanding the cognitive changes people have, we've got strategies that we can help people, haven't we? Of course, one thing we haven't talked about is communication and language, because that's another area of cognition, isn't it? That can be affected quite early on with some people, or, certainly as the condition progresses.
Yeah. And again, language is one of those things, it's one of those domains which are part of the overall assessment. Um, People may perceive subjectively that their ability to find words maybe isn't as good as it once was. Um, and also what is important is how people report this, how they feel about their own cognitive processes is very important. And we've neglected this in the past. We've kind of relied too much on external assessments to see whether, there's a pass or a fail, basically, which is
Mm.
quite controversial because it's unique to each person. But if that person feels genuinely that there are changes which can't be explained and they're different to how they once performed, then I think what we should really be doing is saying, yeah, that is significant in itself, and we should be doing something about it.
Listening to the person, isn't it? And
Absolutely.
their families,
Yes.
absolutely. So, so I know when I worked in the memory clinic, often I would hear stories about a person losing their concept of time or
Mm.
being disorientated in time and place. So, is that another part of, would that come under the cognition umbrella, do you think?
Yes, yes, it would. And I mean, again, how to assess that? You can do that in a kind of formal examination. But really, what is most important is the type of history that you're getting from either the person reporting themselves on their ability um, to be orientated to time, or more often, we rely on somebody else, a carer or somebody who is close to that person reporting it from their angle. So it's corroborative evidence, because that person themselves who's experiencing that might be in denial. They might have no insight into how maybe their cognitive processes have changed. So therefore, it's important to get that kind of third angle to see, well, do you agree with basically what's been reported, or do you see things differently?
Because, of course, the symptoms of cognitive impairment are that a person may be, or they may be unaware, but I think most people are, from what
I
I've
I
seen.
think in my experience, you're absolutely right. I think most people do have a sense of that change, and that's what I think that is probably there very, very early on, that people know that maybe they're just not as quick or as deft as they may have once been. And then I suppose as symptoms gradually get worse, if you've missed that opportunity, then later on there can be a lack of insight anymore, and that ability to sort of like appeal to that person and in terms of being able to help themselves becomes more difficult.
Yeah. So an early diagnosis is vital, really, isn't it? Because we
It
know there are things we can do to help support people.
absolutely, and again, the actual diagnosis itself, and many people say it's like a passport. Then it gives people outside something to really help them to understand what that person is experiencing, but also it gives access to the help and support that you wouldn't be able to get otherwise, because people
Otherwise.
just say,
Mm.
well, we've no idea why that person is behaving like they are. So it's very important from a diagnostic point of view to that somebody has the diagnosis so that they get the right treatment.
And as we as staff then know, and we look at those cognitive changes which need to be measured or subjectively observed or understood as time goes on, because they will change, won't they? But getting that initial, so because we know there are things, strategies, if somebody is struggling with their memory, we
Mm.
know, maybe, things like if somebody's struggling not to see so well, that we can,
Mm.
advise, make the rooms lighter. There's an awful lot of tips and approaches we can help the person and the family. Going back to cognition again, I'm thinking that, there's another aspect, isn't it, around planning, organizing, executing tasks. That's
Executive
another aspect
function.
that could be affected, can't it? And
Yeah, absolutely. And I suppose how that would be apparent is just in that ability to just carry out everyday tasks. I'm not talking here necessarily about complex planning, but just sometimes sequencing. Just a classic example is just asking somebody to make a cup of tea, and there are so many parts to it, but
mm,
it can be so revealing just in terms of them understanding, well, how are they going to break that down? Are they going to do it in the right order? Are they going to complete it even? So again, just a very, very simple thing like that can reveal so much about where that person is at that particular time.
yeah, absolutely. We use that always, and I know a lot of occupational therapists use that as
Yeah,
a
yeah,
as a way to assess somebody. And again, thinking about, so we've looked at as well, it can affect a person's personality, their ability to judge, can't it, and to reasoning, and that can be the difficult side as well, and making decisions, isn't it?
yeah. And again, I suppose it's touching on this thing about making decisions which are safe and all too often there is a tendency to think that just because somebody has dementia that they've kind of lost that ability to look after themselves. I think it's important to consider that and to think about the person's welfare, but very often with the right type of prompts and support, people are no more riskier the day before they have a diagnosis and
Mm.
the day afterwards. It's basically giving some kind of understanding of what it is that they're experiencing, but they're still able to go about and maintain their usual activities and most importantly remain independent for as
Mm.
long as
For as long as they
possible.
can. So in summary, really, we're thinking of, cognition then is sort of, it can be, attention. And I think this is one thing that often gets missed is that attention, that speed of processing
Yeah,
is a huge area, isn't it, where people have really slowed down. So that
yeah.
means that may take longer to take in what's going on in their environments as well, and from the perception side of things. So it's hugely complex. Then there's the language and communication side of things, the orientation to time
Mm.
and place, how to plan, how to execute, I can't say that word,
Execute.
tasks, execute tasks, and language and word finding. And of course, dementia is not one condition, so these things will affect people in different ways, won't they? So
It's so much more than memory, Jane, which is
it
basically
is,
what
isn't
I'm
it?
trying to say. And
Yeah,
the whole thing about having a memory assessment and going to a memory clinic is actually a bit of a misnomer, but we're
yeah.
stuck with it because I think there's a common understanding. Well, that's where you go if you have dementia. But the
Mm.
most important and vital thing to think about is actually all of these facets are being affected.
Mm. Well, thank you, Clive. I think what this shows, though, is how amazing our brains are. And actually, we all take our brains for granted, the things that we do in everyday life. And it's only actually when a person may struggle due to conditions like dementia that we realise actually, wow, how phenomenal our brains are
And how complex.
and how complex. Absolutely. Thank you, Clive.
Thank you.